All right, everyone. So it's interview time, but I just have to say we were already talking about a vas deferens. Already a hard one. And I was like, is that the tube that you snip when you get a vasectomy? And so wait, there's two of them. There's one to each ball. Dr. Dubin here, Dr. Justin Doobie, Dr. Kevin Chu, Dr. Kevito Chu. Welcome to the show. Kevito Chu. Please tell us about the tubes. And this is not the vasectomy episode, but there's two tubes?
There are two tubes. One tube that goes to each ball and it carries your sperm right on out. So if you're getting a vasectomy, you really want to make sure that thing is not connected. Right, Justin?
Right. I mean, listen, there's two of them, so make sure you get both of them in the vasectomy. That's the big point. And yeah, it's basically the highway, connects the balls to the outside world. And that's what we're cutting. That vas deferens. Hence vasectomy.
The vas deferens.
The vas deferens. So when you're snipping the vas deferens, does it affect anything else in the cock owners being? Oh, it's just sperm moving, and that's it. There's nothing else that is blocking when you cut that.
No, it's a beautiful thing. It doesn't affect your testosterone, doesn't affect your erections, doesn't affect your sperm or semen volume. Yeah, it just stops the sperm from going out, and that's the goal.
You're basically shooting blanks. That's about it. Everything else is the same.
There's no hormones. There's no side effects. There's no pimples or weight gain or nasty stuff that happens to you every month that you want to cry or crawl into a ball at all.
Are you talking about where women go there?
I'm sorry. Okay,
Yeah.
Great. Just wanted to verify that.
Confirmed.
Yes.
That's true.
Okay.
and then so these two, so and I think we talked about this, Dr. Doobie, when we did the vasectomy episode, which is a huge hit. We still talk about scrotox and blue balls all the time.
Right.
Scrotox.
Scrotox. Yeah, we asked him, like, is scrotox real? If you all have never heard of it, go listen to that episode. It's the vasectomy episode on Shameless Sex. But I think one of the questions was, when you get a vasectomy, you're cutting these tubes, but there's still some spermies hanging on the balls, right? Are they just like free flowing into the skins, or like, where are they going? Don't they go somewhere still? Or is it cauterized maybe so they get trapped?
Can you save them?
Is there a foundation?
I mean, so what actually happens is the same thing as if you just don't come for a while. They just sit in your balls and they eventually die. Sperm, just like all cells in your body, have a life cycle. They die, and when they die, they just get absorbed back into your body, and more sperm come and they hang out.
They can also form a little bit of a sperm graveyard in some guys. You can feel a little ball there. It's kind of where we kind of like that highway ends. But I tell guys that's a sperm graveyard, because that's kind of unfortunately where they go to die. But it kind of forms a little ball. Some guys kind of feel it and they're like, oh, what is this? And it's kind of strange. But I reassure them, it's just kind of where the sperm die, and it's totally fine.
Is that like a temporary ball? Or is that like you have a permanent ball for a while? Like it's like a lump, little mini lump
ball.
About 7%.
It's like a mini lump.
About 7% of people develop it. It's called the sperm granuloma, is the technical term. Some people it shows up because it's a back pressure, and it disappears. Some people feel it's like the size of a pea. It's not painful. But I like that. I'm going to use that, Kevin. The sperm graveyard.
Yeah,
so is it located? This episode is not about this at all. This is just our opening episode. Yeah. But I just need to know one more thing while you're here. Does it live near the testicles or outside the scrotum region?
Like, is it connected?
Is it in your perineum? Where is this thing? In your ass?
Is it in your ass?
Where? Yes. Where is it? How can we access this graveyard if we need to?
It's definitely not in the asshole.
I didn't think so.
I think it's on the balls. Yeah.
It's actually in your vas. It's at the edge of where we cut the vas deferens, right? So we cut it. So there's a testicle end, and then there's what we call the abdominal end. And so where that cut, tied, burned end of the vas is, it's the stopgap for all the sperm. It can't go anywhere. So that's where, when you ejaculate, it kind of just goes until it can't go any further.
Can we call you with any penis questions ever? Like at 3 a.m, I'll be like, hey,
what's with
Dr. Kevin, Dr. Dubin. Hey, hello, either of you. Are you available? What's happening with this? There's a cock thing that I need to know about.
We got Kevin on West Coast time and Dubin on East Coast time.
East Coast time, so you're perfect.
So I just want to say, yes, I love the sperm graveyard. There's things I'm seeing like, oh, there's nowhere to go. I guess we go to sleep now and bye-bye. Very cute. For our listeners who are obviously listening, and some of them, or a lot of them, have already listened to past episodes, so they're aware of Dr. Dubin over here, who's been on our show multiple times. Dr. Kevin Chu, is new to our show, but we guested on your show, the Man Up Pod, which is super fun.
So
and after that, we're like, we need you both on our show. So we're so happy to have you here. And our listeners already heard a little bit about both of you in the bio.
They're both in scrubs too.
Yeah, and they're wearing scrubs.
If you're not watching us on YouTube
or Instagram,
don't say you don't want no scrub.
Oh,
because I can tell you
want to
might
see these scrubs.
We look good.
They look damn good.
Rock 'em.
Oh yeah. All right. Anyways, back to business. So even though our listeners have heard a little bit about you in the bio, can you please share a little bit more of the background about how you got to where you are today in the field of sexuality?
Yeah, Kevin, you want to start?
So you want to start?
Okay, I'll start. So once again, my name is Dr. Justin Dubin. I'm a urologist down in South Florida at Memorial Healthcare System. Basically, I wanted to get into sexual medicine. It started when I went to med school. I was unsure what I wanted to do, but prior to that, I found myself working in urology at Cornell on the Upper East Side of Manhattan. I thought it was really cool. I had no idea what urology was at the time. I ended up going to med school, had urology still on my mind, and I ended up applying. I went to the University of Miami for my residency, where I actually met Kevin. And we were co-residents, and we both really got into men's health, male infertility there. I ended up going to do a specialty fellowship training for 1 year at Northwestern, where I specialized in male infertility and sexual medicine. I wanted to come back to Florida, so I moved back to South Florida here. I'm a men's health doctor, where I specialize in those things. And really what I think got me into men's health, male infertility, is the kind of stuff we're going to talk about today, is this stigma. I love having this challenge of getting guys to talk about things that they think about, they want to talk about, but for whatever reason, they just don't. And it's often a challenge, and it's really fun to destigmatize these conversations, because as we're going to learn, and I think I've said this every time that I've been on this podcast, is the key here is that sexual health is health. It's a sign of a potential health problem, or it's a signal that something is going to be potentially brewing down the line. So sexual health, we have a good time and it's fun and it's a great topic to talk about, but it is something that you should take seriously. And kind of piecing that together with men's health is just something that I've always been interested and passionate about. That's how I'm here.
That was beautiful, Justin.
Yeah.
That was so beautiful.
Thanks, Kev.
So, my name is Dr. Kevin Chu. I'm a private practice urologist down here in Los Angeles, California. Yeah, I, met Justin in Miami, and we had a beautiful time there. It was really beautiful. But, for many of the same things that he said is, very much the same reason why I got into sexual medicine. This stigma, like guys not wanting to talk about it. I really embrace that challenge, and I'm not going to lie. I love those conversations I have with my patients. When they sit there, I can tell they're like, not wanting to talk about it. And I just go like, yo, man, we're just going to say whatever you want here. It's a safe space. You want to talk about your penis? Let's talk about your penis, And I love that. It's fun. I find so much satisfaction in it. And most importantly, I feel like I'm really helping out with like a quality of life thing, so much is, caught in like, hey, we got to treat the disease, treat the cancer, but, quality of life is extremely important. And so, that's what I really embrace. And that's why I love, partaking in sexual medicine and trying to get people better.
Mm-hmm. I love that. And your Man Up podcast is incredible. And talking to two educated dudes, I don't get a lot of access to that.
Oh, sorry, Sienna.
I'm just kidding. I'm kidding. That was not even meaning to be. I just love speaking to you both, because talking about sex with even educated dudes that don't talk about sex can be this other level of weird.
Like ultimate, like brilliant CEO.
Yes, and it's like
PhD
you say something about
and they're like
anatomy. They're like,
just like penis.
I'm like, obviously you're a literary scholar, right? Okay, there we go. So that being said, I'm not shaming anyone out there. Fuck, and I sound like such a dick. But you know what? I love penis owners. I love a penis. in general. And we talked about this even before we started recording, and then we had to start recording because Amy was like, this is too good. We need to start. I was like, okay, yeah, let's do it.
We were covering some creative
ideas, which we're not going to talk about right now. Yeah. However, but I just like want to preface this first question with my adoration for humans, and specifically penis owners as well. I do love learning about the functionality of penis owners, and also there's so many things that we have, like as a vulva owning human, I have that I feel like my friends that have cocks or dudes, I'm like, yo, you have no idea. So that's just I'm just prefacing it because we're going to dive into some things.
But we have no idea about their dicks. So there you go.
We don't know. And I'm not asking because I'm not a doctor. I can't ask to see it. You know, I'm like, let me see your cock. Yeah. Let me see what kind of palms you have. Let's do a blood panel right here. I'm not a phlebotomist either. So why do you think it's hard for penis owners to talk about their health problems? I don't know if this is just with anyone, but also with their doctors as well.
Yeah. This is a hard conversation, right?
Yeah.
Well, there's a male stereotype, men will not ask for directions, even if lost, right? They just won't ask for directions. And, there's many parallels to that. And, first I'll kind of talk about, look, there's data on this. The British did a survey in 2018, and they basically showed that, only 35% of men would go seek help from, when they experience a health problem. And I believe it was around like 50% in women. Now you go to the other side of the world, down under in Australia, 2016, they did a similar study, and they found that many men were just reluctant to talk about their health. They don't want to talk, they don't want to burden others, and they thought it affected their masculinity. Another survey, 2018, showed that about 66% of men they measured here were not comfortable discussing their health concerns. So, there's study after study that shows that guys just don't want to talk about this. And, I think Justin will kind of talk about why there's a reluctance.
It's kind of exactly what Kevin says. Kevin and I, we call this the directions problem, or I call it the IKEA problem, where you have...
That sounds about right.
This is what we do, right? I'll go to IKEA. I'm going to buy some kind of furniture. I'm not looking at the directions. I'm actually just trying to build this shit, okay? That's just the way I am.
You gotta get it done. You gotta get it. I got confidence in you, man.
I'm not gonna get it done. It's actually what really happens.
I'm gonna hire someone. Can you come over and do this for me?
So you struggle for an hour, you struggle for 2 hours, then you finally go to the directions. And that's what guys do a lot for their health, right? Because there's this societal expectation of men and masculinity. Men, they're going to fix this problem. I'm going to fix the shed. I'm going to fix this. I'm going to fix my health. There's this stigma that, guys picture themselves like they see on TV. It's all over social media. It's all over, television. You got these jack dudes. They're fertile. They're strong. They got beards. And then, if something goes wrong, you kind of don't look like that in your mind. You look like Steve Urkel, or you look like McLovin instead.
Oh, and so
McLovin. We all love McLovin. Congratulations.
McLovin was killing it. He's a slayer. Come on.
He got engaged. He just got engaged. Saw it in the NBA basketball game. Congratulations to him. So there's,
Do we know his real name? Nope. He'll always be known as McLovin, which is fucked up.
I think it's something Mince Platts. Maybe
it doesn't matter because I'll Google it.
A nice Jewish man,
McLovin. It's McLovin. I would get that on my license if I were him.
Yeah,
absolutely. But so it's this idea that guys, they don't want their friends, their family, society in general to have this weaker and masculine vision of them. And there's another combination of this lack of awareness or knowledge of their health issues. You don't know what you don't know. Guys don't sometimes talk about this with their friends. So if they think it's just a common thing that everyone goes through, we hear it all the time. I'm just getting older. It is what it is. And that's really not often actually the case. And sometimes guys don't communicate the way like their counterparts do. And we need to do a better job, and we need to destigmatize these conversations so that they know that it's okay. People have these problems. We can fix them, but we can't fix them if you can't.
So read the IKEA instructions.
Read the instructions.
There it is.
Or just hire someone else to do it.
Yeah, hire someone else. Meaning go to the doctor, listen to the podcast, read the books.
It all ties in.
So I'm curious though. So say someone doesn't read the instructions and they just like put the old IKEA thing on the side and the instructions are hanging out and they don't do anything about it. And the problem that just keeps on going because they don't have a dresser for the clothes to go in. It keeps building and building.
No, the dresser just won't close. It just hangs.
No, they don't have a dresser. It's all there in fucking pieces.
Oh, yeah.
Anyways, so what can go wrong if they don't acknowledge the problems that they're having? They're not seeking help. Like, what are some of the worst case or like semi-worst case scenarios that you see in the medical world?
Well, I mean, Amy, you kind of really just touched upon it. You know, it persists, right? And I'll tell you, as a surgeon, I know Justin and I, like the patients, the guys that we see, that problem's been sitting there and it's just been progressing, right? And the thing that happens with health is that when things progress, you start losing access to some of the things that could have helped prevent it from progressing, right? And so time is of essence. And so that's why we stress on our podcast is always like, yo, you got an issue, you think something's going on, you got to go seek help, you know? And so that is a really important point. Some things that can kind of progress, you know, as Justin said earlier in his intro, you know, sexual health is health, right? So sexual problems may be a warning sign, result of some other health issues like diabetes, infections, heart problems, and you don't relate that with, you know, your penis not working. So, you know, those are some of the things that may happen, these progression of other medical issues, if you don't really go seek help.
Yeah, I mean, it's just exactly what Kevin said. You know, the worst case scenario is you die. I mean, very simple.
There you go.
Yeah, there it is.
Simple. Just to summarize that, right? Like erectile dysfunction is what we call the canary in the coal mine for heart disease. So, you know, you are at a higher risk for a heart attack, stroke, things like that. We know that people, you know, diabetes causes erectile dysfunction. Kevin and I have diagnosed so many people who've never seen a doctor. You know, it's one of those scenarios where, hey, this guy, he's obese, he's in his 50s. I'm like, hey, when was the last time you seen a doctor? He's like, oh, like 40 years ago. I was like, how many medical problems do you have? He's like, no, I'm good. I've got no problems. Like, well, it's because you haven't gone in 40 years. So I see him and I order all these labs. I'm like, dude, you got like florid diabetes. I think you got to go to a cardiologist. And these are things that we see all the time. Why? Because guys, like Kevin said, they delay. And unfortunately, you know, there's a fortunate aspect and there's an unfortunate aspect. Going quickly, there are things that can be reversed, you know, but if you go too long, it's irreversible. And a lot of things that we often hear is, I wish I came in sooner. And they're often surprised that we can help them with the issues and quite readily help them.
This is prevention where it's maximized when it comes to health, because people always talk about preventative health care and doing all these things.
Well, now they are. That was before. It was like
it's also been something that my mom was always like, go to the dentist every 6 months so you don't get a cavity.
Yeah.
But I never did a physical health check because I always had the attitude of, I'm a healthy human. I exercise. Right. I eat well. I don't, you know, I'm not like out in the streets like panhandling for garbage to eat. Like, I think I'm pretty healthy, right? There's so many different scenarios that are more prevalent these days where people, and God forbid if you don't have access to healthcare, and that's a different conversation and podcast. I hope that you do. And I hope that you out there, if you are able to listen, that you can access some sort of medical attention if you are suffering from something. But if you have the ability to be preventative, please do that. And I know that because my father is 70 now, and he always had access to. He's like he's a
our
union
dads
dude.
The same. My dad,
and he was like,
I'm a doctor in 40.
He basically he felt like he's like, I'm a tank, I'm a dude.
And you're like, no, you got other problems.
I don't feel comfortable enough asking him about his cock function, but if I did, I would be like, bro, I don't know what's happening there.
And that's an interesting thing too, because what y'all are saying is that, and we talked about this with Dr. Dubin before, and probably on your show too, was that we compartmentalize health issues, right? So if I have a dick problem, it's just a dick problem, and I don't see it as a heart problem or connected to my brain or other organs. But so, like, you know, our dads might be like, my dick works just fine, so I'm healthy, but
so
really
everything's good, yeah.
Or my dick doesn't work that well, but I'm healthy, and it could be like, okay, so that could be related to major other things that would be worthy of being addressed at some point in life. I honestly think, like, when we're 30 and up, we should be getting regular blood panels and seeing doctors.
This is what my point is.
Yeah.
Exactly what you're saying. Because I'm doing fine. I'm 40 and I'm finally starting to really assess how I am, even though I'm still really healthy. I get like blood tests and like, you're very healthy.
Yeah.
I'm like, thank you. And thank you. Physically healthy is great. However, you can't trust WebMD for everything. Correct. First of all, and second of all, people need to assess and examine you, a doctor, a medical professional. I'm not going to be examining anyone. I'm not a medical professional. So
will you examine me though?
We're in the age of, yes, sure. I'm sure will. And I'll Google it.
Thank you.
We're in the age though, where people, they do rely on internet intervention or diagnoses. So why is searching for things like my dick can't get hard or I have a lump in my balls on the internet? Why could this be a problem?
All right, so I'm going to take this one because I am incredibly passionate.
Justin is
this.
the master of this. He's
done
a lot of studies on this.
Can't get hard, master.
Yeah, no. Well, the master of educating.
He's done a lot of Googling, so he knows. He knows exactly.
I'm just clarifying.
He's like, I read the IKEA instructions, and I'm going to break this down for you right now.
All right, so, but the internet, is good, but it's also a big problem. So, in 2022, 80% of US adults used at least one social media site. 72% of adults use the internet for researching health information. So that's pretty much everyone, right? And for the longest time, we always talked about, at least doctors, we always said our biggest competition is Dr. Google. But we actually now, it's kind of shifted. It's now Dr. TikTok, Dr. YouTube, Dr. Instagram. In fact, a recent study came out, and I found this mind-blowing, which kind of concerning, was Americans, if they have a health problem, before they go talk with a doctor, 33% of Americans go to YouTube for health information, 20% go to TikTok, 37% of Americans turn to influencers online for health advice because they think they were more accessible and trustworthy than doctors. And this is the one that's really problematic. 50% of Americans have purchased health products after seeing an ad on social media. So pretty much everyone is buying shit. And now this is the problem, right? Now, we've done studies looking at health information, specifically in men's health topics on Instagram and TikTok. There's a lot of great studies by some of my colleagues on YouTube, on female health, on all kinds of urological health and all spectrums. And in general, the information is very, very bad. In fact, most of the most popular videos are the least accurate videos. And the problem is because most of this content is not being made by healthcare professionals. They're being made by random people who we kind of, they're pushing a product. They're pushing something.
In scrubs. They're dressed in scrubs. They're like,
hey,
not you guys.
No, not you guys. But I'm saying they're like, hey, look at me.
I feel like when people have when there's a brand behind it, and it's not that you can't be, like you Dr. Dubin and Dr. Chu over here with a brand too, because I believe in building your brand. But like you can tell when someone first and foremost is pushing a product, and so that's scary.
Yeah, but the propaganda is scary because they show you all these before and afters, which sucks me right in.
April's one of those
before
people.
and after, I'm like,
this is your clip before you buy this medicine.
But I've never bought medicine online. Let me tell you.
I
freaked out.
When I was in med school, I bought raspberry ketones from Dr. Oz. I remember that and being like, I'm an idiot. Like, I remember being like, this is going to cure my weight. I'm going to lose weight. And I remember being like, I'm an idiot. Why did I buy this? This was dumb. I was in med school too. But no, so I mean, like
marketing. We gotta call Dr. Oz. What did he do right there? Hey,
no comment.
I'm being sarcastic.
But the thing is, at best in these situations, you're wasting your money. You're burning a hole in your wallet. At worst, you're spending money, you're harming your health by using a product that either doesn't work or hurts you, or you're doing some kind of practice that someone online recommends that they don't know what the hell they're doing. So, it could be time consuming, it could harm your health, and it could harm your wallet. So these are all big, big problems. And, it can get overwhelming because that was social media, but there's other problems out there, right? Online media articles, as good as most of them are, can also be a problem. And, every day there's an article, it comes out. Eggs are bad for you. Eggs are good for you. I have no idea whether eggs are good or bad for you. The same thing, an article I saw today, it was like, having a drink of alcohol a day is great for you. Everyone else is saying you drink alcohol, you're going to die. So what you have to understand,
April and I cheersing to that right there.
Die anyway. I'm going to die someday.
For us.
Dr. Dubin.
Okay. Cheers.
Can you
If I
write
had
a script
drink, I
for
would
this
cheers
white wine?
I am. Moderation, everyone. And we're also, whatever, eggs are good for some people, not good for some people.
I'm allergic to eggs and I still love the fuck out of eggs.
Or don't even get her started with cheese. Sorry.
But the point is, you have to understand the media is searching for clicks. We're all searching for clicks. And there was actually a really interesting study a few years ago where what they did is they looked at online media articles that described research articles. And what they found was pretty concerning. They found that, 48% of these media articles used language that was too strong to describe the study conclusions. So they were sensationalizing study conclusions and kind of making them a bigger deal than they were. That same study showed that 58% of the media articles actually inaccurately reported the study results, questions, interventions, and the actual populations. So not only were the results being sensationalized, they weren't even describing the studies correctly.
They weren't accurate at all. That's so
correct.
fucked.
Completely skewed.
So it's pretty dangerous out there. And that's why it's really important. The internet can be a good place, but it can be very confusing. It can be very misleading and potentially dangerous for your health. So you really have to be careful out there. And that's why, if you see something, before you do something about it, maybe talk to your healthcare provider.
And that was that was going to be the next question that we had, but which I think you kind of already answered it. But so like, is there? So you said talk to your healthcare providers. Maybe this is the answer instead of going onto the internet to go and find all the information.
But you don't like your healthcare provider,
or you don't have access.
Like sometimes your healthcare provider could be like a person that you're like, I don't even know this person.
And there's people who have access to the internet who don't have access to a healthcare provider or do not feel comfortable seeing someone in person. So is there a safe way to get accurate information online? Like, what's the best approach to that?
Yeah.
So as a doctor, I always tell my patients, look, you got to be active in the process. You can't be passive. So you can't just be sitting there letting the information just come to you and being like, that's the answer, that's the answer, that's the answer. Because just like Justin, as we've all been saying, there's exterior motives everywhere, right? People have some sort of agenda. And so, Man Up Podcast, we try to provide accurate information. Shameless Sex Podcast, you guys try to provide great access. So the resources are there, but for all the good resources there's a lot that provide misinformation. So you really have to just, if you're seeing information, there's a few questions that you got to really ask yourself, so what am I searching for? And what is my goal of looking online? Is it to learn about the issue, find the treatment? Am I trying to find a doctor? So that's one. The second question is, who is the person that's providing the information? Is it a doctor? Is it another healthcare professional? Is it just some person off the street? You got to ask these questions. You can't just be like, oh, I believe them. They're a person wearing scrubs, so they must be a doctor,
Right.
Me and Justin are doctors.
Yeah, it's true. Yeah, if you're watching,
I was only saying that because people do trust people in scrubs or doctors.
It's true.
The lab coats. Oh my God, the studies with the lab coats.
It's a whole thing. Yeah. So that's why I said that.
Yeah. There was that kid who impersonated wore a lab coat, went into the hospital.
Exactly, and he was 16 and giving
16, took care of
medical
patients.
advice.
Yeah.
That guy was addicted to it. I think he got caught like 4 times.
He went to prison.
He did. It's like a different form of flashing. It's like a weird, not weird, but sorry, I'm not the judge, but like some sort of like exhibitionist kind of. Yeah. Right. Anyways, yeah. No, anyways, that's not what we're talking about. But people fall for it.
But just finishing.
And so those two things, and then there's two more questions you got to ask yourself. What is the goal of that person? Right? Do they have a motive? Are they here to just inform? Are they, selling a specific product? What's the agenda? And finally, what am I going to do next? I got all this information. Doesn't mean like, all right, I have the answers. No, you should, should I talk with a doctor before I actively act on this information I got? Am I going to do more research? Talk to a friend. So there's many ways, many outlets, but it's not passive. You got to be active, in your own healthcare.
I love that. That's awesome.
I don't know.
I love when people like lay it out like that. Like just
I do too.
steps are like, okay, instead of just like, oh, TikTok told me.
You guys are such cool doctors. And I know you're both very, I think you're very attuned to dealing with like a lot of different sexual health scenarios when it comes to people's like abilities or what they're striving for. And that's atypical in my, like when I visited a doctor, I'm never like, let me tell you about my pussy right now. And I don't because I have a dude doctor, and half the time I'm like, I don't want you looking at anything, because my healthcare, it doesn't matter. We're not going to get there, but I have to, you have to get in where you fit in, and those doctors are harder to get to on the long run. The ones that I want, that I trust.
In the stirrups with like, let me show you my pop. Come on, get in there with that.
I am like that. And I'm like, can you please use some Uber lube? Because I don't want your jack shit, whatever the fuck you're using.
Shout out Uber lube.
And I'd be like, I know this is all just for like medical purposes, but isn't my pussy fabulous? Just have to say, all right, continue on.
I never have them go deeper into, but I have been told that I should be a speculum model.
It's true. She has.
Because wonderful. I can really hold that speculum for a long time. That came from the Planned Parenthood days where I couldn't afford health care. And she was impressed.
Basically,
and now
she has a really nice pussy. Everyone.
Basically, I have strong pelvic floor
Congratulations.
Yeah. Thank you. It does me justice. And this is not what my question was.
Back to the cocks.
It definitely, yes, we're going back to dicks and cocks.
Yeah.
Because dicks are not a phenomenon, okay? Cocks have been here for a long time. You both are owning those. And I love this. Again, every question I'm like, I love your perspective, like both of you. And
thank you.
Justin, we've had you on the show so many times. I love hearing Kevin's perspective too, because they're just like very aligned, but still that you have different things to offer.
Chip and dip.
You are. You guys are like shameless snacks of doctors.
Ooh.
Yeah.
Again, I digress. So how do dudes overcome cock-related health shame, for instance? Because that has to be a thing, because I felt it when I've been in stirrups as a vulva owner. Or if there's embarrassment when it comes to addressing sexual concerns.
I think it's one of those things where sometimes, as doctors, we forget, and I think you guys too, because we talk about it all the time. And when I see my patients, I always get perspective on this because I'm doing a physical exam. And, a lot of guys, I'm like, I just need to do a genital exam. Let me see. And then my first line is always, listen, I know this is like the first time probably if you are a heterosexual man, for a lot of these guys, this is the first time another man is seeing or touching their penis. And I say, listen, this is normal for me. I see this all the time. I'm just going to do this exam. It's completely professional. And I try to set the stage there. And I think that kind of, when I think about it that way, when I'm talking to patients or people who are interested in or overcome or uncomfortable about having these kinds of conversations, I think you really need to the first thing is to really go out there, educate yourself, and understand that sexual health problems are common. Men's health problems are common. 50%, we'll get into it, but 50% of guys have ED. A large majority
age, right?
of guys
at any age, Justin, right?
50%. That's overall. 50% of men will have ED. Testosterone number is 30% in their 60s, 20% under the age of 60. Or 30% in 70s. So these are common health issues, fertility. So, chances are you're going to have something at some point. And the fact is that if you're going to have something and we can treat it, you really need to understand that being embarrassed or being ashamed about talking about something is way worse. And then living with that shame and living with that problem is way worse than going to talk to someone one time about it. That will probably potentially really improve your overall aspect of life. I mean, when you think about ED, a lot of guys identify themselves with their penis. It's a very strong association with sex and their confidence, their life. People live their lives and they look at that, or I'm just not being that confident person because my penis doesn't work. So it does outreach to other aspects of their life, and I think that's why they're uncomfortable about it. But I think that getting professional help, using good, accurate data, and really practicing self-compassion is at the end of the day. Be kind to yourself. You've worked hard, you've lived a long life, you've dealt with other stressors. This should be the least of your worries. And if you go talk with the doctor about it, we can at least alleviate some of those problems.
And you all aren't allowed to like just go and talk to all your friends and say our names as we go and see you. Like so and so's dick can't get hard, right? It's just like talking to one person about
HIPAA.
something. Yeah,
HIPAA.
exactly. HIPAA. And it's very strict for you and licensed therapists. And it reminds me when we used to work at Pure Pleasure in the retail store of selling sex toys, and people were like, oh, I'm scared to go in. And we're like, you do know that, like, number one, if you go in there, you see no one, they're in the sex shop too. So like you have that in common.
That's right. That's
and then point. And we are not going to walk around and be like, I mean,
I used to work at a restaurant and simultaneously, I was in my 20s at working at the sex shop and then at a restaurant, and I'd see someone the same day. I was like bartending,
and
I'm
not
like,
gonna be like, you
I wasn't, but they were like so uncomfortable. They'd be like with their wife or daughter, and was like, don't say it. I'm like, you're all good.
And we don't have to, we don't have HIPAA for that, but like, we're trained in that, and there's trust in that. But like, but you all are, this is a safe space where you're there to hold things confidential and not judge. And yes, I know people have had really hard experiences with certain doctors though that do judge, like kink shaming, certain sexual interests, or and I'm doing complete air quotes, promiscuity, like someone else's personal opinion. So a doctor's personal opinion about how someone else is living. Like I have, chlamydia, and I had 20 sexual partners without condoms, and unfortunately, some of you listen and be like, well, that's irresponsible. But the doctor, I would hope, would be there to be more like, all right, yeah, so let's learn about how STI prevention and, things like that, instead of like, yeah, you really fucked up and you need to change your life. So I get that the fear piece and why some people have different experiences there. I want to bring it back, though, to limp dicks. I say this with love, limp dicks, everyone.
That's not a bad thing either.
I love a limp. We actually had a soft cock episode, so we love some soft cocks. But limp dicks is our guess is one of the number one issues that penis owning folks are coming into the doctor's office for, is for erectile issues. Are we correct? Are we wrong? If we're wrong, what is the number one thing that people are coming in for their cock or men's health issues?
No, you're absolutely correct. Limp dick, erectile dysfunction, medical term, and I know Justin touched on the stat, but up to about 30% of men under 40 will have some form of erectile dysfunction. 40% of men in their 40s, 50% in their 50s, 60% to 60, 70%, 70s. You catch the drift. It keeps increasing as the years go on, and that's the most common men's health ailment or, penis issue that men have.
Yeah. And we kind of, we highlighted some of the reasons why. Obviously, age does play a role. But, we talked about, I think I've highlighted these things, 5 things you need to get an erection, get a good erection. I'll just quickly say them because we've spoken about it before. Good blood flow to your penis. Can be compromised by heart problems, smoking, vaping. 2, good nerves. If you had surgery in your pelvis, like for a prostatectomy, if you have diabetes, if you've had spinal cord injuries, these are all things that can compromise it. 3, you need good testosterone levels. 4, you need to be aroused by your partner, and that's really a sign of, relationship issues is really where that goes. And, there is an aspect of that, where we see guys, I'm having issues with my partner, or I'm having relationships. I'm not as attracted to my partner as I used to be. Unfortunately, these are things that happen in life. And then 5 is you need to be in a good state of mind. Robin Williams, the GOAT, said, God gave man a brain and a penis and only enough blood to control one at a time. So if you're stressed, you're anxious, or sometimes if you are treated for anxiety or depression, you have erectile dysfunction, and that's something that we need you to see. So mental health also plays a role here. So that's kind of why.
When people come in your office and talk about erectile stuff, is there just a way, other than their conversation with you about it, that you can measure anything that, like, in the office? Is there a way that you can actually see like the strength of blood flow in real time, or is it just a conversation that you're having with people? Because we don't have cocks, so I don't really know how that works.
Question.
That's an excellent question, actually. So, the way we kind of measure differences or like kind of see, like, do you have mild erectile dysfunction, moderate? So one of the things that we really base it off is off surveys. So there's a survey, a questionnaire that guys can fill out that we can kind of give them kind of a little bit of a, quantitative measure, like kind of this is where you fall. That's a penile Doppler, which is basically where we actually induce an artificial erection. We basically take a needle, stick it in their penis, and we, get an erection, and we basically measure the blood flow going in and the blood flow going out. And we kind of have
where
some
do you
threshold.
stick it? Like just in the shaft? Like where? I need a visual.
Right at the base of the penis, right about the 9 o'clock or 3 o'clock position.
All right. I just want to know because I was like, is it in the
Dubin's like pointing like the
Not
base
in the
of the finger
peel,
right now.
Okay.
Not in the
I
peel.
just
Peel's
wanted
off
to know.
limits.
Sorry, I didn't mean to interrupt. I just needed to know.
All right,
Okay.
So you're injecting something there. Okay,
Got it.
got it.
Yes. I know this is so. This is
Yeah.
not
So
good.
you inject it. It's an artificial erection. And, or I guess it's an induced erection at that point. And we can measure the blood flow in and out. And that can kind of give us an idea of, what's kind of going on. Are you like not being able to keep the blood in your penis, or there's not enough penis or enough blood flow coming into the penis? So there's those are like the main tests that we do for erectile dysfunction.
I had no idea.
Okay. And then, so obviously mental health it's not even a buzzword or words anymore. It's something that is becoming at the top of the roster for folks to talk about, which I am grateful for, because I think that it probably should have been more considered before it was almost too late. It was never socially acceptable. Where I grew up, it was like, you fucking toughen up and you don't worry about stuff, right? And mental health has such an effect on folks' sex drive, on their capacity for what they can do, even if it's self-pleasuring or pleasuring with partners or partner,
or feeding yourself every day,
or feeding yourself. But we're keeping this solely towards sex right now, because that's a whole different floodgate that we can't open, where we don't have enough time to open. We could open it. However, that being said, people sometimes forget that their largest sex organ is their brain, right?
I love that. I've not used that. That's a good one. That's great.
That's a great line.
Use that. That's an important one.
So when things aren't operating properly here, or you're on medication that fucks with your chemistry in your brain, and your cock isn't working how you want it to, or you're in for sake of this, like I have a vagina, everyone knows that. When it doesn't work, and you're like, yo, like people are on SSRIs that can really affect they inhibit serotonin reuptake inhibitors or something. What are they called?
Affecting libido, desire, arousal.
Yes. Yeah. So it affects your libido and arousal. So penis owners specifically can see that. So what I'm getting to is talking about mental health, and then medications that people have to be prescribed these days. And if they're finding themselves with this lower sex drive and incapacitated because they still want to have pleasure, what are solutions for those folks out there? What do you suggest?
So, first off, mental health is obviously a big issue. Statistically, we know annually, like about 6 million men in the United States will experience depression. 12% of men will experience an anxiety disorder in their lifetime. And in about 2020, I think about 15% of men in the U.S. had a substance abuse disorder. So obviously,
what was that last number?
Substance abuse, 15% of men in 2020. Mm-hmm. 15. Okay. So obviously, the chances are someone a family member, a friend, has some kind of mental health issue. Also, a very interesting thing that happened, and we've already talked about how it can impact your erections. There was a study that came out during COVID showing that Viagra and Cialis sales had skyrocketed during COVID, and there was two theories on it. That one, that people were stuck at the house and so they were just fucking all the time and way more. Or two, that people were having high anxiety, way more depression, and they needed the medications to get it up. So, there is a correlation here. Something's going on. And for the people, unfortunately, who are treated and they did the right thing and they got help, and they're having issues with low libido, low sex drive, in general, I think Kevin and I agree here, and I would love Kevin's opinion here too. In general, I do, unfortunately, we don't manipulate the SSRIs, the antidepressants. That's being managed by a psychiatrist. And what I often do recommend, and we do live in a great time where there's so many different antidepressants that, often I say, listen, go talk to your psychiatrist. Tell them about this, this, and this. Because often, I'm not a psychiatrist. I don't know how often they're asking those questions about their sex. So I'm not going to, I'm sure they do. But sometimes, there's give and take. And you say, listen, I want to try a different one. Let's try a different route. But there are also potential medications that we're starting to learn about that are in addition to increase your libido, your sex drive. What do you think, Kev?
Yeah, no, I think you put it well. Basically, the way you approach these issues. Look, when I talk about sex, I always go like, it's a biopsychosocial, right? There's the biological aspect where, Justin and I can really help from like getting the blood flow in. But then, it's multidisciplinary. We got to work with the psychiatrist, be like, hey, this guy, he's on these SSRIs, it's helping him, but his quality of life has been diminished from the sexual aspect. So like, how can we work together? And, they specialize in that. So, they're going to offer their expertise, and we'll kind of try to see how we can kind of work with them and try to work together. And then from a mental aspect, I'm a big believer, therapy. You need a therapy, see a sex therapist, because this is where you're going to really, be able to dig into certain issues and be able to talk it out. And once all these things kind of come together, that's when you're really going to, find that, hopefully that, improvement that you're looking for.
I think the sexual therapist, the relationship therapist, I got to piggyback off Kevin because that's so important. I found myself literally, I referred, I would say 3 people today, almost like I saw 3 people today in my clinic, sent them to a therapist for the first time.
Nice.
And it is such a big part because you know what, anxiety, depression, relationship issues, sometimes you don't want to take a medication, and maybe sometimes just talking to someone will get the job done. And I agree 1,000% with Kevin.
And there's also things you don't have to talk to people too.
Well, and and sometimes you need a whole team, like you were saying, like, you both were saying this, right? Kevin and Justin, you're both saying this, that like, it's not just like, oh, I go to my doctor, so I'm cool, or I go to my therapist, so I'm cool. And maybe you are, but sometimes we need
stuff too.
Yeah.
Like, that's important. People don't know about.
You might have someone gives you this, the meds for your depression, and then you have the doctor, the MD for your physical health, and then you actually have someone more for your emotional state. And I love the idea of all working together. And I just want to say, like, I've gone to an MD before where I was describing my own dissatisfaction with having a lower libido for what I wanted at, being in my like mid to late 30s. Right. And I saw a man. I don't think all men are like this. You guys probably wouldn't be like, let's boost that up. But this person was like, well, yeah, no, that's just pretty normal for someone your age. And I can't really justify it with the, in the insurance company to actually be something to just to get a blood panel, like a hormone panel. Like justify it as a thing. Hence why I started going to see Remy and Dr. Castillo, who's in our area. And so I was like, okay, well, I disagree that this is just normal for being 38. I'm not happy with it. It's been happening for a while. I am a sex educator, sex and relationship coach, and very aware of all the tools.
You're like, I'm not 99 years old.
I know all the tools over here on how to boost my libido. And I feel like there's something hormonal going on. So I'm going to end this phone call and find a new doctor. And so I did. And so I just want to say that to people, if you've had a mismatch experience where you haven't felt seen with someone, or like maybe it wasn't something that you should be seeing an MD for, or a psychiatrist or a therapist, because we have all these different offerings of people that you can see, to continue to stay open and explore and find someone that works for you, because they are out there.
Well, this is what I want to say about talk therapy. And you actually, Amy, know a lot about, like, I get exhausted from talk therapy. I can do it to a certain extent, but some of the more somatic approaches that, I don't know, from a Western medicine side, I'm not even opening this up with you, but if you're not into that, if you're like, I've been a talk therapist, you might need to find the right one, or explore other avenues that are out there, which we've talked about on so many different shows. You just have to find, it's like dating on the dating app.
You're dating,
it's like hard.
Dating your doctor is
possible.
And this is why podcasts are great, because people could listen, hear you all here, because you guys are probably the same as you are. Like we are too, right? When you meet us in person, Amy and April, the same as on air, and you probably are the same
I
too.
try to be the same person.
Yeah.
And so this is a great way to do your research and development to see if these are people you want to work with. And before we find out more about how to work with you and all those fun things, we have one other question though. So what if you're
we can never let them go.
No, okay, so you're staying with us forever.
Staying with us forever.
All right.
We can
so
come back. We'll come back
what's your favorite color? What do you
Walks on the beach.
Yeah. If you could only eat one cuisine for the rest of your life, what would it be? Okay, anyways. So for advice though, for folks who have partners, or their loved ones that are penis owners. So like so my partner is a penis owner. Let's say my partner's penis owner is having issues with their own sexual health. How can I be supportive for them in their sexual health journey and the stigmas that come around that? And it's not just me as a vulva owner, by the way, but like any partner of that person.
Partner.
Yeah.
So, things that you can do, and I think it's a common theme that you guys get in your podcast as we get in our podcast, communication and listening, right? So being a very good listener is important, listening to the concerns, listening for any signs or issues, because the more you listen, the more they're going to be able to kind of communicate and get information out, right? And so that communication is super important. Second is kind of creating a safe and like non-judgmental place. The worst thing you could do is, someone suffering with, sexual health issues and just kind of point them out and make fun of them, Third is especially guys, right? And, educate yourself, learn about the topic. So that way, when the discussion happens, kind of show like, you kind of understand what's going on. And, finally, really, it's just to encourage them to really seek professional help. Justin, anything to add?
Yeah, I mean, you really highlighted it. I think that, a lot of times we see guys who are embarrassed, but they were brought in because of embarrassment. After like chronic embarrassment, it's compromised their relationships, it's compromised maybe some friendships. And like, you don't want it to get to that point, right? And if you're trying to support your partner, I think, listen, the bottom line is I don't care if you're 18, you're 90 years old, you're going to get an ED at some point, even if it's one time. And if your partner can't get it up one time, don't make fun of them. Don't think it's you. It's probably not you. So, I think like how you handle, especially sexual health, which is an incredibly intimate thing. We're talking about it pretty openly, but for most people, it's an amazingly intimate thing where, you're sharing yourself, you're sharing your most personal self. And, to be as non-judgmental and to be as open and thoughtful as possible when someone's being so exposed to you, I think really goes a long way. And if you can put it in a positive light, like kind of Kevin said, hey, listen, we're in this together. I'm with you. We want to get this right together. And kind of put it towards we're going to go through this together and that they're not alone, I think really goes a long way. And often for guys, and I think Kevin will agree, is a lot of the times I have with my patients, it's their partner is there with them talking about the issue. And I think that those are the best appointments because you hear both aspects of what's going on. And sometimes the truth comes out there and it's never a bad thing. It's a very honest conversation. So, I think just being present and being there, your best ability is availability. And if you can go to that appointment with them, as long as they'll let you and they feel comfortable, I think that's also a really positive thing. And it helps, bring out the full picture.
Did you say your best ability is availability?
Your availability.
Yeah.
Justin loves that.
Because we'll trade. So you can.
Yeah.
So you can have your brain is your largest sex organ, and we're going to use that one.
Yes. Yeah. But I also want to. I think something that I'm taking back from what both of you shared is that shame culture it's equal to cancel culture. It sucks. Like, let's not shame people. And whether you're experiencing it yourself, don't shame yourself. Whether you're experiencing this with a partner, let's not shame. Like, I don't like cancel culture. I never have. And I don't think that shaming people is great, which Shameless Sex was built on a lot more, and it's evolved to so much more because shame within sexuality it's very it's like a fungus that will grow and
bacteria.
It will, yes. It's like that the zombie apocalypse of sex, right? It's going to kill you if you don't seek treatment. And there is a solution here, and that's listen to podcasts that are free resources, and then visit people that know and that care. And the Man Up podcast, first of all, is a free resource for folks out there. And then you can visit your urologist. And if you're not in the LA area, you can't. If you are, you can visit. Well, I don't know. I should ask. But I know that Dr. Kevin Chu is in Southern California, and then Dr. Justin Dubin is in the South Florida area.
Miami.
So to trust the people, your practitioners, is important, and also know that let's have a more shame-free realization about what happens with our bodies. And I think, Dr. Dubin, you said it so well. It doesn't matter if you're 18 or 90. This stuff can happen to you at any age. And sexuality it's like the ocean. It ebbs and it flows. It comes and it goes. That one you can also trademark. I give it to you.
You didn't create it on her own.
I just thought of it right now. Okay. So that being said, though, if folks want to find you, please listen to the Man Up podcast. This is why we love them so much, for so many other reasons as well. But if you're not listening, please check them out. And then how can people find either of you, both of you? Outside of that, how can they work with you? And also, where is your podcast and where are you on socials?
Social security number 2.
And then what's your credit, and we need your address to text me. Thanks back.
Yeah.
I'll go first. So I'm practicing in South Florida at Memorial Healthcare System. So if you just Google my name, Justin Dubin, you can find me and book an appointment. My socials are at Justin Dubin MD on Twitter, Instagram, TikTok, all of that jazz. Then we have our Man Up podcast. Our socials are at the Man Up Pod. And you can find our Man Up podcast on all podcasting platforms, Apple, iTunes and Spotify, Amazon, YouTube. Kevin, our website. What's our website?
Website's
where do we live?
www.themanuppod.com.
All right, where can everyone find you?
And one of those voices that is like the advertiser.
He has a great voice. Kevin has
oh my God, you nailed that.
And Dr. Chu, can people work with you as well in your area?
Yeah.
Okay.
So again, my name's Kevin Chu. In the Southern California area. I do in-office visits as well as telemedicine. Just Google me. You can go to my webpage, kevinchumd.com. And on the socials, it's at kevinchumd.
And we'll have all the links in our show notes as well.
Absolutely.
Well, Kevin, do you want to do our voiceovers over here?
Sure,
Dubin, you're cool too, but
no, he's got a great voice. He's got a great voice.
Your voice is powerful. It is like the Geico commercial. Dude.
Thank you.
Is that the same as Aflac?
I don't know. Maybe it's all car insurance. There's some kind of insurance.
But seriously, I did want to say, you guys do an amazing job. We're talking about destigmatizing things, and you guys are truly the masters of destigmatizing sex, destigmatizing these conversations. And it's always a pleasure. It's always an honor to come on. We model ourselves after you guys and the way you carry yourselves, the way you guys talk, and the way that you guys set up your podcast. So it's really always such a blast. And we really love coming on, and thank you guys so much.
We're going to come all over us again.
You guys will be coming over here again. You're going to be coming again and again on Shameless Sex. No, but seriously, you'll be coming back.
And you'll be coming back, and you're coming back on ours.
We'll be coming on each other a lot. Back
all over.
I want to say, for whatever reason, that IKEA instruction thing got me so hard because
got you hard.
It got me hard, like
on
humorously.
You got
I've had so many boyfriends and boyfriends of past and present and future, that have. I don't know, figure it out. And I'm like, bro, you put the motherfucking screws in the wrong hole.
I thought you were saying you got turned on by. I was like, that's
the way that y'all both were talking about instructions, but I didn't think about. I thought when it was directions, I was thinking about before we had GPS. So that's where my brain went. And then when you brought up the IKEA thing, I was like, oh my God, it was so good. And I laughed, I was cry laughing. So I hope that everyone enjoyed it as much as me. And if not, you know what? I'm a twisted human over here that just like enjoys
That's why we love you.
weird IKEA magic. All right.
The meatballs.
Adore you both. Love the Man Up podcast. Love the work that you're doing. Thank you for radically helping people help themselves and their partners out there, penis owners and everyone out there that's listening. I hope that you've taken something back from this, even if it's the IKEA instruction joke that we shared earlier. That was
like,
good.
I need to go to IKEA now.
I know. I love it. Yeah,
New sponsor.
Yeah, not sponsored by IKEA.
I could be. We have a lot of fucking furniture from them. So that being said, I want to also express love for the good podcasts like the Man Up podcast. Thank you to our Shameless Sex listeners for valuing us. We're 6 years old now. We're 6 years old. We just had our anniversary, our podcast anniversary.
Congratulations.
And it doesn't feel that long. I feel so good about where we've been and where we're going. And
it's from all the scrotox.
You're just getting started. I'm excited for the book.
Yes.
I'm excited.
Thank you.
Our
book will be out. So to all of our listeners, thank you. You really do mean the world to us. And remember, this is a free resource for each and every one of you. You can tune in anytime. All we ask is that we hand select every single advertiser that we have on our show. We get a lot of offers for things, and we choose particularly the ones that we vibe with the most, that we think you would love as well. So check out our ads. There's only a few every episode. That helps us keep our lights on, our dogs fed, our lives lively. And I'm not going to do another invitation, but you know what I'm talking about if you haven't reviewed. Okay. I'm not shaming you. I'm shaming myself for not saying it. I reviewed myself. I did. So we love you. Review the Man Up podcast too. Listen to it. Check it out. Spotify, all the ways. Yeah. And we will see you next Tuesday, y'all. Thank you for being part of the Shameless Sex Revolution. Thank you to the doctors that came in their scrubs. They didn't really come. They just showed up. Okay. Just don't
we were talking about don't worry.
The camera only shows below.
Yeah.
It only shows up here. So
nobody knows what's happening below.
Yeah. You have to check it out on YouTube. They're handsome
That's our
doctors. I'm not gonna lie. I get all hot and bothered by the doctors. All right, y'all. Ciao for now.